Thanks for joining us for this special edition of Up with KREM. I'm Tim Pham. Breaking overnight, Pfizer just announced their vaccine works on kids ages 5 to 11. The company is going to seek authorization for the age group soon, and this is a big step towards beginning the vaccination process for kids under 12. For the study, the company tested a much lower dose on kids, a third of the amount that's given to people over 12. After that second dose, the kids developed coronavirus-fighting antibodies as strong as teens and young adults. Pfizer's president says the kids had fewer temporary side effects such as sore arms, fever, and aches. And we know this has been a big topic, so we want to hear from you. It leads to our question of the morning. Do you think kids under 12 should get vaccinated? Text us your comments to 509-448-2000. We're sharing your messages throughout the morning. Our local doctors are seeing parents hesitant to get their kids vaccinated for COVID. And as we get closer to the FDA approving the shot for younger kids, our Nicole Hernandez talked to a local doctor about why it is safe for children. Good morning, Nicole.
Yeah, good morning, Tim. So I'm live at Multicare right now where we're seeing more COVID-19 cases in kids. Nationwide, 25% of the COVID-19 cases are from kids. So we spoke with 3 teenagers who all got the COVID-19 vaccine and say they're glad they made that decision.
Getting the vaccine was an easy choice for the night teenagers.
I just don't want to not get it and risk getting other people sick and spreading it more.
Spreading it to people like their dad.
17.
I personally just wanted to protect my dad.
Their dad is Larry Knight, who we introduced you to last week. While Larry waits for surgery, COVID is a real fear for his family.
The medication he's on makes him immunocompromised.
The vaccine has made them feel safer.
Oh, 100%.
Yes.
Yeah.
Yeah, it's definitely 100% worth it.
Worth it for other families too. Dr. LaSalle with Multicare Deaconess tells most of her families they should be vaccinating their kids.
We've had more kids die from COVID than we have in even a bad flu season typically. So hundreds of children have died.
Dr. LaSalle says kids 5 to 10 could start getting the vaccine as soon as early winter.
It's very safe. Kids tolerate the vaccine very well.
She says long-term side effects really should not be a concern for parents.
Our immune system responds in the same way, no matter what type of vaccine we're talking about. We've had measles and mumps and pertussis and all these vaccines for decades, and we don't see adverse effects that happen 5 or 10 or 20 years later.
Where we do see problems later in life, though, is from the viruses themselves.
Well, chickenpox, decades later, it causes shingles. Measles, a small percentage can develop a 100% fatal neurodegenerative condition. Polio can cause post-polio syndrome.
So Dr. LaSalle says the safest thing to do is get your kids vaccinated. In Spokane, Nicole Hernandez, KREM 2 News.
This morning, we are expecting an update on COVID-19 in Washington hospitals. Right now, 36% of all ICU beds are still filled with COVID patients. Last week, the Department of Health announcing that the state is seeing the highest rate of COVID cases and hospitalizations since the start of the pandemic. More than 1,500 patients were hospitalized with COVID 1 week ago. Health leaders say hospitals are experiencing extreme stress, but despite a number of cases among students, schools do not appear to be the source of outbreaks or super spreader events. Providence Chief Medical Officer is expected to speak at that briefing. It starts at 9 a.m. and you can watch it on KREM.com. Here are 3 things to know about the COVID vaccine progress for children. Right now, kids ages 12 and up can be vaccinated, but why is the process taking longer for younger children than initially expected? The FDA asked for 6 months of follow-up safety data instead of the 2 months it asked for with adults. It also asked Pfizer and Moderna to double the number of children ages 5 to 11 in clinical trials. Pfizer says it will apply for emergency use authorization sometime in October. So this means there should be a COVID vaccine for kids 5 to 11 by Halloween. After Pfizer submits for emergency use authorization, the FDA will evaluate benefits and risks, a process they say could take just a matter of weeks. Well, take a look at this graph we want to show you here. It shows some of the common side effects from the COVID-19 vaccine in children ages 12 to 15. You can see that discomfort ranks at the top of that list at number 1, with about 77% of kids saying that they felt some sort of fatigue, and then less than half had muscle pain or chills or a fever. Vaccine advisors with the CDC will meet this week with the COVID-19 booster shots, and they're expected to be on the agenda. The Biden administration had hoped to start administering them to the general public by this week. But on Friday, FDA advisors only recommended booster shots for people 65 and older and those who are at high risk. A CDC report finds among the Moderna vaccine, it has the highest vaccine effectiveness against COVID hospitalizations with 93%. Pfizer, meanwhile, had 88%, and Johnson & Johnson's vaccine was 71%. Researchers at the University of Washington are looking for volunteers for a COVID vaccine booster trial. You must be at least 18 years old, healthy, and vaccinated against COVID for at least 4 months. It leads us to our question of the morning. We're asking you, do you think children under the age of 12 need to get vaccinated against COVID-19? You can vote in our live Twitter poll right now or text us your thoughts to 509-448-2000. And we're talking about your responses. Someone saying, yes, kids should be vaccinated. Until then, they should be homeschooled. Another person saying, yes, children should receive vaccine love one another. And one person writing no. So again, let us know what you're thinking about this, 509-448-2000. And if you want to read more about Pfizer's vaccine study on young kids, please text the word vaccine to 509-448-2000, that same number, and we'll send you all the new information that came in overnight.